Hi everyone, I am Dr. Andi. Welcome to today's Facebook Live. While I give everybody an opportunity and a chance to log on, I will give a brief introduction into who I am and my role with Prove It as well. So I am an educational specialist with Prove It. I have been with Prove It from the very beginning, one of the very early days, so from our first sort of Prove It event in San Diego. So I've had the opportunity to watch Prove It grow and the community grow. My role is really to provide education for you. I like to share my experience, my research with ketones as well, but also how I use ketones in practice and with my patients. So I'm a naturopathic physician. I've been practicing for 12 years now. I'm up in Toronto, Canada. And so I like to share the impact of exogenous ketones, the ketogenic diet on my patients, how I use them, the research that I've sort of pulled together in my practice. We focus a lot on chronic illness, chronic fatigue, fibromyalgia, Lyme disease. That's a really big focus. I do a lot of hormonal balance in men and women, hormone replacement. And then we also do a lot of cognitive focus, so reversing and preventing cognitive decline. And those are really some of the primary areas that we focus on in practice. And the foundation of our practice is always that low carb keto lifestyle. And then obviously introducing exogenous ketones into my practice once those became available as well. They've been really significant, made a really significant difference and change in my practice for those individuals who weren't really able to transition to a ketogenic diet or were looking to optimize the ketogenic diet as well, and doing both keto and exogenous ketones. That's sort of how I personally use ketones. I've been keto for many years, long before it was sort of the fad that it's become. In this day and age, I've been keto for over 10, sort of 12 years at this point. And I do cyclic keto, so I sort of cycle in and out of a ketogenic diet, and I do take ketones daily, usually twice a day I'm taking them. I'll take them first thing in the morning, and then also to fuel a workout, I'll take another one in the afternoon at some point, about 30 to 60 minutes before I head to the gym. Okay, so let's start diving into your questions. I want to make sure that I get to as many as I can. I know I always miss some, but I do try. So I will try and get to as many as I can. And Danita, you're always welcome to come to Canada. That would be lovely, although it's freezing here now, so I don't recommend doing that until the summer. So are ketones good for children? So the exogenous ketones are currently approved for adults 18 and older. But I do always recommend that people refer to the website, the Charlie Foundation, to get a little bit more information on the research with respect to ketones, ketogenic diet in children. There's a lot of research. There's a lot of research looking at the role of ketones in kids, especially how beta BHB will impact ADHD and things like that. So I do generally have people refer to the Charlie Foundation to get a little bit more information, a little bit more research there. But there is quite a significant amount of research being done in that space, looking at the role that beta hydroxybutyrate can play in children and in some of the things that they're dealing with as well. So check out the Charlie Foundation. But again, our ketones are approved for 18 and older. I have gotten questions before. Do I give ketones to my daughter? My daughter is 2. Yes, I have done that. I give her obviously the caffeine free, and just I love giving her the banana flavored one. So I'll give her sort of a half or a quarter of a sachet and a large thing of water, and she absolutely loves that. Or I'll freeze them into popsicles or something like that. So I have done that as well. But again, you have to work with your healthcare provider, make sure they say that that's safe for you and safe for your kids to take, and then check out the research on the Charlie Foundation as well. Is the pink grapefruit flavor safe to take if you're on medication that has an interaction with grapefruit? So that's a good question. So generally, yes, when we say something is sort of grapefruit flavored or cherry flavored or something like that, usually it's just flavoring that's being added. So you should probably be fine if you're on medication. But again, check with your healthcare provider. And if you're really concerned, just take them apart from each other. So just make sure that you're leaving sort of a 2-3 hour gap in between any medication and any supplements that you're taking. And that should be all that you need to do in that sense. But again, talk to your healthcare provider. But again, you should be fine if it's just a little bit of that flavoring within a product. Salts in the NAD and high blood pressure. So I always refer people back to the article called It's Not Salt's Fault. Salt has been demonized in the same way that fats were demonized in the past. We know that salt is not as detrimental to our health as it was once thought to be. It may not also be as detrimental to blood pressure as we once thought it would be. The people who do need to be concerned are people who, for example, have a salt sensitivity, or if genetically you're prone to high blood pressure if you do consume salts. But overall, the research doesn't really support that high sodium is directly correlated to high blood pressure in that way. So talk to your doctor always. Check out the article, It's Not Salt's Fault, and that might help guide you a little bit, but speak to your healthcare provider about that. Why do gnats make you thirsty? So usually people experience thirst if they're getting a little bit dehydrated. So we know that the ketogenic diet and exogenous ketones can really act as a bit of a diuretic. So it's important, if that's what you're experiencing, add some Mitoplex, the electrolytes, right, and mix them with your ketones and drink them together. Make sure you're getting enough magnesium. That's usually all that you need. Does it help with a flare-up on Lyme disease? Oh, Lyme is one of my primary areas of focus and practice. I've been treating Lyme for about 10 years now. I also had Lyme disease, now recovered or in remission, however you like to refer to it. So I've been sort of Lyme healed since 2018. I would say that keto was the foundation of my personal Lyme healing process. Obviously, there's a ton of other stuff when it comes to Lyme, and tons of antibiotics and botanical supplements, lifestyle, a lot of things you have to do when it comes to treating Lyme disease. But ketones were actually really an instrumental part to Lyme. Also helps a lot with the fatigue. The sodium is also extremely helpful in Lyme disease as well, especially if you're experiencing POTS, which many people with Lyme do experience. So would it help with the flare-up? Yes, absolutely. I won't go too much into Lyme disease and the underlying contributing factors to Lyme, and the inflammatory and the cytokine storms that cause symptoms and things like that. Lyme is a really intense process for treatment, but again, ketogenic diet and exogenous ketones are really a staple of that treatment for my patients, especially because a lot of people have neurologic conditions that they're experiencing with Lyme disease, and we know that there's a really significant body of research looking at beta-hydroxybutyrate and the impact that it has on the nervous system. So yes, absolutely, with Lyme disease, I'm incorporating ketones, but also incorporating a ketogenic diet. That's sort of the foundation. So every patient who comes into my office, and we get about 80 referrals for new Lyme patients a month, every patient, first step is they're put on a keto diet. That's a very first step for Lyme disease. So very, very important to get the BHB into your system if Lyme is what you're treating. You're post-surgery keto, but you haven't lost a pound in 2 months. So that's actually a great question. I love the weight loss questions when it comes to keto and taking exogenous ketones. So first thing to remember, so when it comes to a ketogenic diet, how you follow a ketogenic diet will be different for everybody. Oftentimes, what I find out people are doing is that they're really, really high fat and not low carb enough, or so they end up being high fat, high carb, which is a recipe for weight gain. And then I find that sometimes people are overdoing the fat anyway. So you can have too much fat. So usually what I encourage people to do is to track your food. Nobody likes to do that long term, but just do that for about 2 to 4 weeks to get a sense of what you're consuming, how your macros are coming together. I will often aim for 50 to 60% fat. When it's coming to weight loss, you don't have to go up to 70%, for example. You don't have to be quite that high. So I'm often aiming 50 to 60% of fat for my patients for losing weight. The other thing to remember if you're taking exogenous ketones as well is beta-hydroxybutyrate has been shown to accelerate fat burning, or fat loss, but it's important to remember that it's not actually, beta-hydroxybutyrate is not a weight loss supplement. That's not actually what it is. We see fat loss as a secondary benefit to what the ketones are doing in our system. And it's also the next step it's important to remember is to take a look at the other underlying factors that might be impeding your ability to lose weight. So inflammation, gut health, hormones, so that includes thyroid hormones. Do you have an underactive thyroid? Are you moving into andropause? Are you moving into menopause? Are you high stress, meaning you're spiking cortisol? cortisol will cause you to store fat specifically around the middle. So you have to look at some of the underlying factors as well that might be impeding fat loss. And I always say it's important to remember that the ketones are still working internally. The beta hydroxybutyrate is doing things that you can't see. And so we're all coming from a different metabolic state. And so for some people, it just takes a little bit more time. I don't generally encourage crazy, crash diets or anything like that. The weight will come as the body becomes balanced. So just make sure that you've addressed all those underlying factors as well. Can I drink ketones when I'm intermittent fasting? Yes, absolutely. I always encourage drinking ketones during a fast. So intermittent fasting, I usually have my patients do a 16-hour fast from dinner until the first meal the next day. And yes, I'm allowing my patients to have ketones in that fasting window. We know that a lot of the research on fasting, shows that some of the benefits may actually be due to the production of ketone bodies that occurred during that fasting period. And so I do want my patients I'm really trying to optimize what we're doing in that fasting window, which is the production of ketone bodies. So I do always allow my patients to have their ketones in that fasting window. Is this recommended for people who are addicts? So this is actually interesting. They're doing some research right now looking at addiction and the role of beta hydroxybutyrate. I can't say, yes, absolutely, this is what somebody needs to do to help. It's not going to harm. So it's not going to do further harm if somebody is an addict. So they can absolutely take it, but there is some research right now looking at the role of beta hydroxybutyrate and addiction to see if it plays a positive role there as well. Again, it's not going to cause harm, but I'm not going to say obviously that the research I don't think is strong enough right now to say, yes, here are the exact benefits with respect to addiction, but that research is being done right now. And again, it's not going to cause harm. Are there any electrolytes that don't have creatine in them? Oh, you're allergic. So I'm sorry you're allergic. I know that makes the mitoplex a challenge for you. You could even just do some Himalayan salt in water, but there are tons of really good electrolyte products on the market. You just have to make sure you look at one that doesn't have artificial sweeteners and doesn't have added sugar. So anything like stevia or sugar alcohols are fine. Again, you can also just do Himalayan salt and water, or even just sort of make your own electrolyte blend at home if you're not able to tolerate the creatine. Can we chat ketones and autism? So I touched a little bit on ketones and children earlier in the call today. So with respect to autism, what they're finding is that beta hydroxybutyrate impacts the brain of children with autism in the same way it appears to impact the brain of children with epilepsy. And we know the ketogenic diet was created to manage seizures in children with epilepsy, and we found that the beta hydroxybutyrate can actually impact the brain waves. And what they're noting in children with autism is they have similar brain waves to children with epilepsy, and so we suspect that this is why they see a positive outcome with beta hydroxybutyrate in autism as well. So again, I would refer you back to the Charlie Foundation to get some really great research on that. But there is some promising research in the space of autism, ADHD, and obviously, of course, epilepsy in children. Is Signal OS AM/PM a good product to use long term? Yes, absolutely. That's something that you can use long term. Not a problem to continue to use that. We also get that question about either taking ketones long term or being in a ketogenic diet long term. So yes, these are all things that you can do long term. With respect to a ketogenic diet, I usually end up having my patients cycle, so I'm more on board with cyclic keto. So people coming in and out of ketosis, I find that that's much more sustainable. No one's ever going to follow a ketogenic diet strictly forever, indefinitely. So a cyclic ketogenic diet is more what I encourage for my patients. Need help with water retention after ketones? You need more electrolytes. I know that sounds counterintuitive because I need you to drink more and take in more fluid, but you need to make sure that you have the electrolytes in there. It could be a sign that you're a little bit dehydrated. So add that mitoplex right into your ketones and just drink them together, and that should help a little bit with some of that water retention. But of course, also check with your healthcare provider, make sure nothing else is going on, because there are some other conditions that can contribute to water retention. And so we want to make sure that we're not chalking something up to a beverage that you're consuming when really it could be some other health condition going on. So just make sure you talk to your healthcare provider. Can I drink more than 2 ketones per day? Yes, absolutely. You can absolutely drink more than 2 a day. It's really difficult. It would be really difficult to overdose on ketones. I think the last time we counted, it was something like 40 sachets a day to be able to overdose. So yes, you can definitely take more than 2. Ketones are water soluble, so if your body doesn't use them, they're just going to come out in the urine. So yes, you can absolutely take more. Usually I'm encouraging 2 a day, depending on the therapeutic goal. Some patients I'm having them take more, especially if they're not following a ketogenic diet. Are ketones helpful for stomach issues like bloating, constipation, heartburn? So there's some really interesting research looking at the role of beta-hydroxybutyrate and the gut. There's research actually now referring to those who follow ketogenic diet. They're calling it the keto biome with reference to the microbiome, because the beta-hydroxybutyrate is being shown to actually positively impact our microbiome. So they're seeing changes in the gut microbiome when people are following a ketogenic diet or with the beta-hydroxybutyrate in their system. So we know that BHB will encourage healthy gut or healthy microbiome production as well. We also know that the beta-hydroxybutyrate will impact the inflammatory cascades, and we know that often there's inflammation in the gut when somebody has IBS or something like that as well. From a constipation standpoint, I would say you have to look, again, if you have chronic constipation, you need to look at what the triggers are to that. Usually it's a dietary trigger. Sometimes people need a little bit more magnesium to help manage some of that constipation. The only concern if you suffer from constipation is that oftentimes if you're really dehydrated, you need to make sure that you're taking your electrolytes and your magnesium, because ketones can act as a bit of a diuretic. So just make sure if you're constipated, that you're taking all the electrolytes you need, you're drinking a ton of water, and add in some magnesium. Research on beta-hydroxybutyrate and breastfeeding. You're right, there's not a ton specifically on beta-hydroxybutyrate supplementation and breastfeeding. So in that sense, you have to work with your healthcare provider. We do know that breastfed babies are often in ketosis. We also know that pregnant women will actually go into ketosis a little bit faster. I drank ketones when I was breastfeeding my little one, but again, you have to work with your healthcare provider. Make sure that they say that is safe for you and safe for baby as well. Ketones breaking the fast. I touched on that a little bit earlier. So no, it doesn't break the fast. I do allow my patients to have ketones in that fasting window. Do you do telehealth over the internet? Yes, I do. I do virtual consults quite frequently as well. So do ketones help with mood and sleep? There's some really interesting research looking at mood and sleep, and it does tie in a little bit to some of the research being done with respect to addiction and mental health. And so what they're finding is that beta-hydroxybutyrate will encourage the production of a neurotransmitter called GABA. GABA is a very calming neurotransmitter. It's something I'll often give to my patients who have anxiety attacks. I have them chew GABA capsules. It's very, very calming to the nervous system. And what they're finding is that beta-hydroxybutyrate actually encourages the production of GABA. And so we see this often in anxiety. We see this often in people who can't sleep because their mind is just racing. So in that sense, this might be why we see some people have benefit from taking ketones before bed, because of that the calming impact that it has on the nervous system, and because of that production of GABA. So that might be why we see some of the impact on mood and sleep overall. You're an ex-addict and this has helped you so much. That's fantastic. I'm so happy to hear that. Another addict as well, and you're down 30 pounds. That's fantastic. I love when you guys share your stories, so feel free to do that. I'm obviously, as a provider, a doctor, my favorite thing is to hear positive health outcomes in patients who have made changes or life changes. So I love hearing all those stories. So thank you for sharing that. I drink ketones twice a day, but it makes you have a bowel movement a lot. So I'm assuming it gives you more frequent bowel movements, or maybe diarrhea is what you're referring to. That can happen initially when your system is just adjusting to having ketones or beta-hydroxybutyrate in your system. So often what I will suggest is, if necessary, just reduce to maybe half a sachet a day, or half a sachet per serving. See if that makes a difference. But if it makes you, again, in a regular day, 1 to 2 bowel movements in a day is actually normal. Even 3 times is normal. I think in this society, a lot of people suffer from constipation. So many people are going once a day, once every 2 days. So if you're going 1 to 3 times a day and it's not loose, it's not diarrhea, you're probably fine. Otherwise, if it's causing frequent bowel movements, diarrhea, things like that, then you just want to cut your serving down a little bit until your body adjusts or adapts. And then you should be able to move back up to a full serving. Can taking ketones long term impede your body's own ability to make ketones? So the research is not actually showing that taking ketones impedes your body's ability to make ketones. What it's showing is that it's actually amplified. So if someone is already in ketosis and you take exogenous ketones, it seems to be amplifying the blood ketone level. So it's sort of not canceling each other out. And you will, again, if you stop taking ketones, your body will still remember how to make ketones in the future. So that shouldn't be a concern. You're definitely able to take both, especially if you're already following a ketogenic diet. What can I do about hair loss? So hair loss is a great question. So we get a lot of questions about hair loss following a ketogenic diet. The first thing that you have to consider when you're experiencing hair loss is just the way that the follicles work is you have to look at what happened 3 months before, because that's what would have triggered the hair loss. So it's not as if your hair loss is starting and you have to think, well, what did I do today or last week that's triggering that? You have to look at what happened 3 months prior that is starting to trigger the hair loss, which also means that when it comes to hair regrowth, it takes a little bit more time. So it's going to take you a few months to start seeing that hair regrowth as well. If you're experiencing hair loss from a ketogenic diet, usually the only time I see that is when somebody's not getting enough healthy fats in their diet. And so they're really following low carb, low fat diet. So that's someone who's doing just sort of vegetables and protein all the time, and they're not getting the healthy fats in. You need fats to make hormones. Hormones are essential for for helping with hair production, so thinning hair, also brittle nails, dry skin. We need hormones for that. So the only time I see hormone dysregulation, like thyroid dysregulation, as well as when we're not following a ketogenic diet adequately. The things that will also contribute to hair loss, so again, hormone disruption, so underactive thyroid, autoimmune thyroid conditions, menopause, so loss of estrogen, loss of progesterone, low B12, low iron, those are all things that can contribute, and high stress. So you have to make sure you take a look at some of the other factors that are going on in your life and just make sure that those have been addressed. And if they have been, then you have to look at some of the other underlying contributors that might be causing some of that hair loss for you. Are ketones okay to drink before bed? Yes, absolutely. The proton, yes, absolutely. You can drink it before bed. But again, you want to make sure there's no caffeine in there so it's not disrupting your sleep. Would drinking ketones typically have an effect on tooth sensitivity? No, not usually. It shouldn't impact your tooth sensitivity. So that shouldn't be an issue. Taking ketones before bed. So yes, you can take ketones before going to sleep. Again, it can have some of that calming impact on the nervous system, can actually help with sleep. Can you talk ketones and medical cannabis use? So I'm just wondering if that means if you can take them at the same time. So yes, absolutely. Again, speak to your healthcare provider. But we have a lot of patients, again, part of my patient demographic are those with Lyme disease, chronic pain. So a lot of our patients are on CBD, THC, and ketones. And so there's no issue in our practice with that. We haven't seen there shouldn't be any negative interaction there. If you're concerned, again, just make sure that you separate it, take them away from each other, and then of course, make sure you speak to your healthcare provider, make sure that they say that that's safe for you. How long does the ketosis last? So, however, the amount of time that ketones will remain in your system will be different for everybody. It depends on how quickly your body uses them. So for example, if you're using your ketones to fuel a workout, you're obviously going to use them very quickly. And so your ketones will probably be used as a fuel source for your workout. And so after your workout, you're not likely to have much left in your system, depending on how intense your workout is. But generally, they're going to last anywhere, I'd say from 2 to 4 hours, again, just depending on how your system is using them. If you really want to know how long they last in your system, then measure your blood ketone levels, not urinary ketone levels. and that will give you a better sense of how long they're staying in your system, but that will be different for everyone. How do I stop overeating and emotional eating? So I would say that's a really big concern for, especially actually these past 2 years, a really big concern for a lot of my patients that are coming in. Beta hydroxybutyrate has been shown to help curb some of those food cravings, but if there's an emotional eating and an overeating picture, there's so much more to that. So therapy is really important, understanding, the triggers or the trauma that's contributing to those food behaviors, and often that goes long, long back to childhood. There are often habits that we have to break as well. So this gets into the role of neuroplasticity. It has so much less to do with willpower than people think. A lot of people will think, well, why don't you just stop eating those things? If all it had to do with was willpower, it wouldn't be such a concern for so many people. What ends up happening is our brain maps pathways for food addiction, essentially. And a good example is, let's say as a child at 3 p.m. you'd come home from school, your mother always gave you a cookie. Your brain has now mapped that at 3 p.m. you eat sugar. And that will continue into adulthood. And so changing behaviors as an adult requires rewiring and remapping the brain, overriding pathways that might have been set from childhood, habits that might have been set from childhood. So it's so much more than just, how do I stop doing this? There's a whole process that you need to go through to overwrite, remap, rewire the brain, break those habit pathways. And so the beta hydroxybutyrate can help with some of the food cravings, but there's some work to do as well from a neuroplastic side and a mental emotional side to really help you address some of those food behaviors as well. You were told to increase, so do ketones affect the liver and the bile ducts? So no, you shouldn't have any detrimental impact on the liver or bile duct health as well. So shouldn't be any issue there from taking beta hydroxybutyrate. I know often people are concerned about gallbladder health. With beta hydroxybutyrate, the only concern with gallbladder would be if you, first of all, have had your gallbladder removed or have some issues with your gallbladder and you're following a ketogenic diet. That means you'll probably have some issues digesting fat, and then you'll need to be taking a supplement with ox bile in it to help to digest fat. Because we never want somebody to go on a low fat diet. Your body needs fat. Your brain needs fat, your cell needs fat. So we need to make sure you're getting your fats in, so you just need to help your body process. But no, there shouldn't be a detrimental impact on liver health at all with beta hydroxybutyrate. Will biotin help with hair loss? Yes, biotin helps. Vitamin C helps. Collagen will help. A lot of things can help with a lot of other sort of supportive nutrients that can help with hair loss. And then, of course, making sure you're supporting underlying cause, hormones, thyroid, nutrient deficiencies. All of those things will help with hair loss. Is it normal to bleed for 12 days when starting to take ketones? So no, not usually. So I think there are two things to consider there. One is just to make sure it's not a coincidence and you're not experiencing some hormonal shift. Usually when somebody has prolonged bleeding in that way or spotting, things like that, it's usually because the body needs a bit more progesterone. So there's a hormonal imbalance, an estrogen dominant piece that needs to be addressed. We do know that ketones, beta hydroxybutyrate, can impact hormones. So sometimes I'll just tell women, give yourself 2 to 3 cycles to see what happens. But I wouldn't say that the bleeding for 12 days would necessarily be correlated to ketones. So I would see your healthcare provider, get that checked out, make sure there's not some underlying cause or reason that you're having that extended bleeding. Get your hormones checked, get your progesterone levels checked, because you might need some other sort of supportive hormones in that sense as well. There's a lot to look into for that, but I would definitely have that checked out. But BHB and ketones shouldn't cause 12 days of bleeding consistently that way. You experienced issues of diverticulitis. Okay, so you had a trigger of diverticulitis when taking your ketones. So what I always tell people is that anyone can be sensitive to anything, especially in our one of our population bases, which is Lyme, chronic fatigue, chronic unexplained illness. So I would say when someone takes a product, and I can say 99% of people will respond in one way, it's always possible that 1% will respond in a different way. We can be sensitive to anything. Our body can respond in any way. It might be that you had a sensitivity to something that was in the ingredient. So if it doesn't sit well with you, it just doesn't sit well with you. because it caused a flare of your diverticulitis, it's up to you if you want to try a different flavor or taking it at a reduced dose. But again, anybody can be sensitive to anything that they take. And so if something that's causing a flare for you, then it's probably something that you should stop. Even if for most people it's very well tolerated, some people it might even be helpful, but if it's causing a flare for you or a trigger, you either need to reduce, switch flavors, or you may just need to stop altogether. So you're gonna have to talk with your healthcare provider and really figure out what the best way forward is for you. So that is all of our time today, everybody. That flew by. Hopefully I got to most of your questions. As always, I'll try and scroll through and answer any that I have missed. So it was great connecting with you. I can't wait until we're able to connect in person again this year. So enjoy the rest of your week and stay healthy, everyone.